Here's another example of ankle CT with inappropriate reconstructed planes or multiplanar reformats. So the axial images were obtained, as you can see here. And it's pretty typical. We have to get whatever the scanner can give us. But then in terms of reformatting, if you look at this attempt at a coronal and sagittal image, let's look at the cut lines that appear on the axial images. You can see that this image is simply done parallel to the tabletop with no regard to the actual anatomy or position of the ankle. Similarly with the sagittal, done perpendicular to the tabletop, again without any regard to the position of the ankle. And so you can imagine, depending on whether the ankle is externally rotated or internally rotated or to what degree, that it is going to make a difference in the appearance, and we're trying to be very consistent with the appearance so that we can use our sort of internal mental database to make good, accurate diagnoses and to make sense of the anatomy. And if we get something different every time, that's a problem. So I want to show you how to do it. What you do is, for an ankle, you go to the level of the malleoli, that is, these parts on the bumps that are on the medial and lateral part of your ankle, and that should be the axis that you use to determine coronal and sagittal images. So going the intermalleolar line, let's say, going from here to here, should be how you create coronal type images of the ankle, and going perpendicular to that line should make the sagittal images. So we went back, and I'll show you, let's see here, this, and you can see that these coronal images are now done basically close to the axis of the malleoli. I would have probably made it slightly more oblique like this, but you can see how the ankle looks. It has, you can see the whole, what we call the ankle mortise nicely. It's like an oblique frontal ankle radiograph. And then the sagittal images are perpendicular to that line. Okay, and that's how you do ankle reformats.